Tomato flu, also known as tomato fever, has emerged in India's Kerala state among children younger than 5 years old, prompting responses similar to those used to contain the probable fourth wave of COVID-19's appearance. Although COVID-19 is not considered to be fatal, it is in an endemic state, thus it is best managed with vigilance to prevent further outbreaks. Although it is yet to be definitively established, the so-called tomato flu is a mild but highly infectious illness that is similar to hand, foot and mouth disease. The exact nature of the virus is still being determined by researchers. This video is going to be about the new viral infection detected in India, self-restricting disease. Tomato flu virus symptoms are similar to those of COVID-19, including fever, tiredness and body aches, with some COVID-19 individuals also reporting skin rashes. However, COVID-19 is not related to SARS-CoV-2. It's possible that children's tomato flu is not a virus at all, but rather a secondary effect of dengue or chikungunya infection. Hand, foot and mouth disease is a common viral infection that typically infects young children and people with compromised immune systems. Therefore, this virus may also represent a new strain of this disease. Occasionally, even people with fully functional immune systems have been found to have this illness. 5 since the symptoms of tomato flu go away on their own, and there is currently no treatment to treat the illness. Tomato flu. What is it? Tomato flu, caused by the non-polio enterovirus Coxsackie virus A16, is extremely contagious and spreads by secretions from the nose and throat, fluid from blisters, and fecal-oral pathway. The COVID-19 and tomato flu viruses both display similar respiratory symptoms. However, other research implies no resemblance between this virus and the COVID-19 virus. Children under 5 were the main victims of this tomato flu virus. Various scientists claim it resembles the disease, foot and mouth epidemic. The COVID-19 virus is more threatening than the tomato flu virus. To stop the spread of the tomato flu pandemic in India, however, the effective management of this highly contagious illness is necessary. The danger of infection to the tomato flu virus is higher in younger kids. To stop the infection from spreading, it needs to be managed properly. If not treated properly, this virus could have lethal effects similar to COVID-19. Because of the way it looks, this virus is also known as the tomato flu virus. The tomato flu virus causes red blisters all over the body as the first signs of infection. These blisters keep growing and taking the form of a tomato. The tomato flu virus is the name given to this virus as a result. The particular enterovirus frequently infects youngsters under the age of 5. Hand, foot, palm and mouth blisters are possible side effects. According to Dr. Sushila Kataria, Senior Director at Medanta Hospital, sometimes they generate red blisters that resembles tomatoes, which is why it's called tomato flu or fever. Tomato flu symptoms. The Union Health Ministry lists a number of additional symptoms along with blisters, including exhaustion, nausea, vomiting, diarrhea, fever, dehydration, joint swelling, body aches, and typical influenza-like symptoms. Children are typically affected by this illness, and kindergarteners frequently experience flare-ups. Doctors also cautioned against scratching these skin lesions because they are very contagious. On the mouse palate, glaring ulcers can be visible. The illness begins with a slight fever, poor appetite, malaise, and frequently a sore throat before progressing to fever, mouth sores, and a skin rash. These early symptoms match those of other viral diseases. Typically, these sores appear on the tongue, gums, and inside of the cheeks, palms, and soles. According to officials, children should be swiftly isolated for 5 to 7 days if they exhibit symptoms to stop the sickness from spreading to other kids or adults. Regions where the virus has spread. On May 6, 2022, the Kollam region of Kerala reported the first case of tomato flu. As of July 26, 2022, the local government institutions had documented the infection in more than 82 children under the age of 5. Ayankavu, Nadivartha and Ankal are the other Keralan regions impacted. The neighbouring states of Tamil Nadu and Karnataka were alerted to this endemic viral disease. The Regional Health Research Centre in Bhubaneswar also noted that 26 kids aged 1 to 9 had the illness in Odisha. Other than Kerala, Tamil Nadu and Odisha, no other parts of India have experienced the virus effects of yet. To monitor the viral infection spread and stop it from spreading to other regions of India, the Kerala Department of Health is taking precautions. Who and how can catch it? Since viral infections are widespread in children this age and propagation is most probable through close contact, children are more likely to be exposed to tomato flu. Additionally, the fact that they use diapers, touch dirty surfaces and put objects straight into their mouths puts them at very high risk. However, if the epidemic is not contained and transmission continues unchecked, older individuals may be at risk. If the tomato flu outbreak in children is not contained and avoided, transmission will have major repercussions by spreading to adults as well, according to some reports, given the similarity to hand, foot and mouth disease. Without medical intervention, tomato flu typically gets well on its own. However, health officials have recommended individuals to take preventative steps, such as isolating cases if suspected for 5 to 7 days after the onset of symptoms to stop the outbreak from spreading. Is there any treatment available for tomato flu? Tomato flu cannot be treated or prevented with antiviral medications or vaccinations. To stop the infection from spreading to other youngsters or adults, it is advised that isolation be practiced between 5 and 7 days after the onset of symptoms. It claims that maintaining appropriate hygiene and sanitization and avoiding diseased kids from exchanging toys, clothes, food, or other things with other non-infected persons are the greatest preventative measures. Patients are typically instructed to drink plenty of fluids and get enough rest. Additionally, obtaining plenty of rest is essential for treating severe body aches. To stop the tomato flu virus's chain of transmission, patients are typically quarantined. In addition to these, doctors frequently advise supportive care, such as paracetamol for the treatment of fever and bodily aches. Tomato flu prevention techniques. The old saying, prevention is the best medicine, is true when it comes to tomato flu. The most effective strategy to protect our kids from tomato fever is to take preventative measures because more research is required to understand the reasons and develop a cure. Here are some precautions to take in order to avoid contracting this flu. Refrain from getting too near to an infected individual. Explain to your kids how illness affects the body. Inform them of the symptoms and signs of tomato fever so they can keep a safe distance from anyone exhibiting or experiencing those signs and symptoms. Advise them to avoid shaking hands, playing with, or cuddling any kids exhibiting tomato fever symptoms. Encourage kids to practice good hygiene and refrain from actions that involve bodily fluids such as thumb sucking or nose picking. If they experience a runny nose or cough, advise them to cover their mouth and nose with a handkerchief to prevent the disease from spreading. Prevent the sick child from giving non-infected kids their toys, clothes, meals, or other belongings. Remind them not to massage or scrape the blister and to wash their hands after touching one. To keep them hydrated, encourage your kids to drink lots of water, milk, juices, etc. If your child exhibits tomato fever symptoms, isolate them. Frequently wash and sterilize all of your children's clothing, toys, and other belongings. It is advised to wash or clean your child's skin with warm water. Include immune-stimulating foods and nutrient-dense foods in your child's diet. That's all there is for today. Leave us a comment of your thoughts on new viral infection detected in India. Also, make sure to leave a like and subscribe to our channel if you enjoyed the video, and click the notification bell to never miss our videos. Stay tuned.